series. And tonight we're going to talk about something that is on everyone's minds, and that is getting vaccines. But first, as always, before we get to our special guest tonight, we'll give you just an update on what has been going on in Oakland. Messiah, if you could provide the slides. I know health experts will be talking a lot more about this during the night, but basically our adjusted case rate is 37.7. You can see from the chart just how dramatic this surge has been. This has literally been our worst and most serious moment, our largest losses, our worst amount of suffering that we have seen during the beginning of this pandemic from late March. While our 7-day rolling overall positivity rate is down, and that is the first time I have seen anything come down in a while, our overall test positivity rate remains at an incredibly disturbing 8.6%. And our Bay Area capacity in our intensive care units is a startling 7%. And of course, we've all seen the news that all of Southern California, the Central Valley, ICU capacity is completely gone. So we are still in an incredibly serious moment. Next slide. We remind you that COVID testing remains free. I just got my 5th test last weekend before I went out to volunteer for MLK Day. You don't need a doctor's note. You still don't need insurance. You still do not need to talk about your immigration status. It is easy. It is free. There are sites near you. You can find out more by visiting covid-19.acgov.org and bookmark that website, covid-19.acgov.org, because it is also where you can register to get notifications about vaccines. Next slide. That's something I did too. Again, same website. There's a special section just on vaccines. So this is your one-stop shop about information. Not only can you find out where you can get a free test, but you can register to get notified based on your occupation, your age, your status. You will find out when it is your turn to get vaccinated. And I know that if you're like me, there is someone that you love that has been lost to this horrible disease. Imagine a time when we can hold each other again, be together again as a community, dancing, eating outdoors, celebrating. The only way that we will get back to that time, the only way we will stop losing the ones that we love, is if everyone gets vaccinated when that vaccine is available to you. So please plan to get vaccinated when that vaccine is available to you. And in the meantime, please have patience and give grace to our incredible public health professionals as they manage this unprecedented moment. Next slide. Other good news in Oakland. This week, we released a study of an innovative public-private partnership that we launched a little more than 2 years ago. Keep Oakland Housed was so proud to announce that in 2 years, we have kept 5,000 Oakland households from becoming homeless or being displaced from their housing. This is an unprecedented result. We set out to keep 1,000 people over 2 years housed. We kept 5,000 people housed. This is a picture of a beautiful young man, Marquise, a single dad who was working full-time as a musician, lost all his income due to COVID, was homeless, now is housed with a roof over his head and that of his beautiful daughters. So learn more keepoaklandhouse.org. If you know anyone who is experiencing housing insecurity, who is couch surfing, they do not need to be a tenant or facing an eviction, although there is free legal assistance as part of Keep Oakland Housed. Please contact keepoaklandhouse.org. And I want to thank the Oakland City Council. I know Council Member Dan Kolb is watching tonight, maybe others are too. Thank you for directing the $5 million in CARES Act funds for rental assistance to Keep Oakland Housed, which is partnered with all of our great nonprofits, our community outreach organizations, to make sure that those who need it the most are getting access to this valuable resource. Next slide. We also announced Oakland as a sponsor, and I want to thank Peter Radu on my staff that was actually on the drafting team of a monumental state bill, AB 17. It would create a permanent, significant source of funding, $2.4 billion a year, to fight homelessness. It would invest first and foremost in prevention, things like Keep Oakland Housed, as well as permanent affordable housing, as well as a capped amount, a smaller amount for emergency or interim housing or shelter, with a special focus on youth. So AB 17, please watch it. Please advocate with the legislature that we pass this historic bill. It returns corporate tax rates back to 1980 levels. It closes a Trump tax loophole. That small adjustment could put us on a path to actually ending homelessness in California once and for all. AB 71. Next slide. We also celebrated Dr. Martin Luther King Jr. Day here in Oakland Monday. Don't let COVID stop you from being of service and making your commitment to volunteer. In Oakland, we are all committing to 40 days of service in honor of Dr. King. To find out ways that you can volunteer safely from home or out in the community in a safe manner, please visit oaklandmlk.org. That's me picking up a lot of garbage off the streets of the Fruitvale. So please, it's a chance to get out, make a difference. You can do it safely from indoors or safely outdoors, but it is a very important year for us all to renew our commitment to community service. Next slide. Oh, this was a wonderful inauguration week. I know we're here to talk about vaccines, but personally this week, I feel like I got a shot in the arm when I saw the United States swear in President Joe Biden and daughter of Oakland, Vice President Kamala Harris. Oakland showed up in such a beautiful way to celebrate this momentous occasion. And one unique way is that Oakland and Scranton, Pennsylvania selected two artists right after we got the election results. And they collaborated on this beautiful Scranton-Oakland unity flag. This idea that West Coast, East Coast, a traditionally Republican city and a traditionally Democratic city, can work together in unity and heed the call of President Biden that now is a time for our whole country to come together. So special thanks to Fabiana Rodriguez, our Oakland artist, that co-designed this beautiful flag that is now flying over the city halls of both Oakland, California, birthplace of Kamala Harris, and Scranton, Pennsylvania, birthplace of President Joe Biden. Next slide. We also participated at the special request of the inaugural committee in a day of remembrance. Oakland obviously has lost so many lives, seen so much suffering. And so at the request of then President-elect Joe Biden and Vice President-elect Kamala Harris, we illuminated City Hall in a light amber, joining city halls across the country. And at 2:30 p.m., we rung the bells at churches throughout the city. And here is a number of healthcare workers and other vital community volunteers and leaders who at that time, as the bells rang, released 20 doves into the air to show our belief that hope is on the way, to also show our appreciation for all those healthcare workers and other essential workers who have gotten us through this pandemic. So thank you, Oakland, for being part of that national moment. Next slide. So we tonight have a fabulous lineup, the actual experts on vaccinations in Alameda County. In all our town halls that we started nearly a year ago, I have never seen a town hall where we have gotten so many questions in advance. Our speakers tonight will try and answer those questions, but if you are watching live, you too can put your questions or even your comments to us through Thought Exchange. Thought Exchange gives you a nice way to submit your own questions or to vote up or down other people's questions to move them to the top of the list. Please click on the icon that you see on social media channels, or if you are joining us by phone or Zoom, you can text 979-032-991 to the number 72855. I'll remind you about the Thought Exchange at the end of the presentations. I will end here with a request. This has been a difficult year. And I believe that as we saw our daughter of Oakland, Kamala Harris, get sworn in, to me, she exemplifies strength and grace. Our public health officials have been doing an amazing job. They have been working so hard under such difficult conditions now for months. So as you send them your questions and your comments, please give them the grace that they deserve. Let us show up, Oakland, with compassion, with some patience, and with a knowledge that no one has gone through this before. And so it is with that I want to just quickly give you an outline of our three guests you're going to hear from tonight, but please give them some grace and appreciation with your questions and your comments. First, we're going to hear from our own, it's like I always say, you're like Alameda County's Dr. Fauci, our official health officer, a very important person for us, and you have been throughout this pandemic. Dr. Nicholas Moss, thank you for being with us again. You are always fabulous. Second, we're going to hear from Greg Hodge, or many of us call him Baba Greg, just a beloved, respected community leader. Tonight, he is here in his capacity as the chair of the Community Advisory Board on Vaccinations. And finally, Neetu Balram, the Public Information Officer for Alameda County, to answer your questions as well as to talk about how the county is doing very targeted outreach to get the right messages out to the right communities. So let's kick it off with Dr. Moss, our health official. Dr. Moss.
Thanks, Mayor Schaaf. Really glad to be here and appreciate the invitation. Of course, Oakland's partnership through so many things related to COVID and of course other areas as well. And just wanted to thank Oakland residents for all of their sacrifices during this extremely difficult year. So I have a very small number of slides, just kind of, everybody knows the hot topic is vaccines, and we're going to spend a lot of time on that. Greg and Neetu will have a lot to share, but I just a few slides from me setting the context, where we are today. So next slide, please. So this is really what I'm going to cover. The winter surge is showing signs of improvement. The mayor mentioned she had seen, that there's a lot of bad news in the numbers, but there is some good news, and we'll talk briefly about that. I just will touch briefly on these, the regional stay-at-home order and of course, reminding people to stick with what we know works with COVID: distancing, face coverings, and hand cleaning. So that's really, my big messages before we dive deep into vaccines. But let's have a quick look at the data. So next slide, please. So these are the daily reported cases of COVID going back to May 1st in Alameda County. Almost, not quite, but almost to the beginning. And I just want to draw your attention to, at the right side of the screen, this big increase in cases that we've had since mid-November, up to almost 1,300 cases reported in a single day, but many days over 1,000 cases reported. This is way more than we saw during the summer surge. When we talk about COVID in Alameda County, really the impact has just been in these last few months. I know it's been hard all year. We've been dealing with it all year, but what we saw in the last few months really was far more than what we had seen before. And the good news is it does appear to be leveling off. That orange line is kind of a rolling average, an attempt to kind of smooth out the noise that we see in these daily reports. And you can see it is starting to head in the right direction. This slide was just prepared today, so it's very up-to-date information. Next slide, please. And similarly, we have seen during the last few months a huge increase in the number of people hospitalized. The mayor showed pretty much the same information at the top. And what I want to comment on is just that this is on top of a very difficult year for our healthcare providers. Of course, very sick people, but also everybody in masks and isolation and a lot of fear. And so the people who provide care in our healthcare system are really tired going into this, and they've been dealing with a very challenging situation. But actually, Alameda County, we have managed to do okay. What you're seeing in this slide is that we increased quite a bit through December, and then things have leveled off, and the hospitals have kind of held up, and people have been able to go get care, and we've avoided some of the challenges that have been seen in other parts of the state. But we're not out of the woods yet. We really want to see these numbers come down. Let our healthcare providers get a little bit of a break. And so, I'm hopeful that given the what we've seen with the case numbers, that these hospitalization numbers will start to drop as well. It usually takes a few weeks after case numbers start to drop for our hospitalizations to start to drop. Next slide. So the state has ordered stay-at-home restrictions for most of the state that were because of the impacts on our healthcare system, because intensive care unit beds were so full throughout the state. As different parts of the state got impacted by the winter surge, the state ordered people to stay home. In Alameda County and across most of the Bay Area, we adopted these restrictions about a week before the state applied them here. I think that has paid off. We've really been able to, again, as I said, avoid some of the worst outcomes we've seen in other parts of the state. People often ask, well, why was this closed and not that? And I think, the purpose of these orders was really to keep everybody home. It wasn't about one sector or another. It was to keep everybody home. And they're still in place. I'm hopeful that they'll be lifted soon and we'll be able to get back to reopening. We know from our experience here in Alameda County, and actually people have looked at this around the world, these are one of the few things that really work to control surges. That's why you're hearing about it from around the world. And I think it has helped here, but now we are able to start looking towards reopening, which will hopefully happen soon. when this state order is lifted, for those of you who've been following this, we'll go back to the color tier system that the state introduced last summer. We'll probably start in the purple tier, but that will mean more things can open up. And as our numbers continue to improve, we'll go into the red tier. Over time, be able to open up more and more activities. Remember, though, there's a lot of COVID around still. And so even as we start to reopen, we're going to need to keep doing all those things that I mentioned at the top, the face coverings, keeping our distance, really limiting gatherings, and keep, hand hygiene, the things that have been proven to work. I know vaccine is here, but we need to stick with those simple things that we can all do to keep each other healthy. Next slide. So this is really just to set up the rest of the presentations. I wanted to just remind people where we were, but vaccine is the story of the day, and I'm looking forward to the conversation and hearing from people's questions about this. It's a very hopeful time. Obviously, it's moving more slowly than we've hoped. You've probably heard about this in the news, but we'll hear a little bit about the whys and where we are today as we go forward. And that's it for me.
Cool. Well, thanks, Nick. My name is Greg Hodge, and I want to thank the mayor for a really kind introduction. This is a really important time for all of us, and I want to acknowledge a few things. First, those of us if you have any spiritual belief, just acknowledging a creator and however you call that, acknowledging our ancestors who put in a lot of good work for us, and particularly the 400,000 neighbors and moms and dads and aunties and tias and abuelas that we've lost over this last year to this terrible thing. I also want to acknowledge that all of us, everyone on this call, everyone who may be in the household that you're in, we all have a role to play. There's something that we can all do, whether it's giving a good message to someone, whether it's giving someone a meal when they need it. Sometimes it's just holding somebody's hand if you're in that bubble. And so I want to thank Nick Moss, one of our leading doctors here. I want to thank Noha Ablada over at Roots Community Clinic. I want to thank Damon Francis, another one of our doctors over at Alameda County Health Systems, as well as Kimmy Watkins-Tart and everybody who is part of our public health system, our frontline nurses, our doctors, everybody, because everybody is really doing their part. I want to really just acknowledge, too, that this notion of trusted messengers, and Mary, you can begin the slides if you would. This idea of trusted messengers comes to us in a lot of different ways. And just for those who know me and Libby and others, just as a point of personal privilege, one of my trusted messengers is my daughter, Shanaka Hodge. And yesterday, I called Shanaka and asked her about Amanda Gorman, the young lady who did a poem at the inauguration, this beautiful poem that was called The Hill That We Climb. And there's a line in that poem I think it's apropos to those of us who want to do good work, that we want to message to other people, that this idea that she said that when we merge mercy with might and might with right, then love becomes our legacy and we can change our children's birthright. But that idea of merging our power, our resources, our energy with that which is right. And this disease, this pandemic, is causing all of us have to kind of come together. The best news I had last year was that in addition to being one of Amanda Gorman's mentors and working with her through Youth Speaks, there was the most important news of the year for our family was that Shanaka had a baby. And her daughter, Aziza, was born on December 30th. So I'll always think, well, 2020 was really hard, but 2020 was really great. And so I encourage all of us to look for something joyful in this as we go. Let's go to the next slide. So I want to talk a bit about this idea of trusted messengers, how we get the word out, and a different orientation to making sure that people get access to the vaccine and then actually take it. And I want to credit Dr. Damon Francis with this notion of, as opposed to thinking about we need to have messengers who sort of tell people and convince people what they should do, we should pull back just a little bit and think about this as informed choice. That this campaign to make sure that as many people as possible are vaccinated is part of a bigger idea of when we give people accurate, consistent, and clear information, that's the building block for trust. That when we think about the multiple methods from old school to digital platforms, there's a lot of ways that we can communicate what we need to communicate. And that if we can activate our trusted messengers as storytellers who have resources at scale, not only will we defeat this pandemic, but we'll lay a foundation for the kind of community engagement that really creates real equity, real fairness in the society, that creates that might mixed with right that Amanda Gorman talked about. Next slide, please. So this notion that these are building blocks for trust, and I'm going to just say that, trust is sometimes is this sort of elusive term, but the notion that trust is based on information, that trust is based on, and in the African American community, there's some legitimate reasons over the history of our presence here in North America for us not to trust systems, for us not to trust medical providers. The Tuskegee syphilis experiment, which allowed people to go untreated when it was known by doctors in those Army doctors that there were folks who were infected, is obviously, it's like this historical thing in our head that says that we should kind of have the orientation not to trust. So I think that we have to overcome a lot in every community, and all people of color communities, to overcome the obstacle with facts, with science, and with common sense. If we can go to the next slide, Mary, thanks. Trust is, and many of us know, and think about this in a lot of different ways, but the idea of trust, this ability to be comfortable with a decision, to be comfortable with a person, comfortable with a set of recommendations that would then change our behavior, is based on two things. It's based on consistency, and it's based on time. Most of us that we have any relationship with anybody, that consistent idea of facts, that consistency of science, that consistency of sharing and breaking bread together, and transparency and of accuracy of relevance, to be consistent means that it gives us a head start in creating trust over time. And when trust can get built and we can hold on to it, the challenge is not to destroy it overnight. You can spend a lot of time building trust, and in a moment, if a moment of lack of transparency, a moment of dishonesty can often make that trust just evaporate. And so when we think about this notion of trusted messengers, I want you to think about who are the people that over time giving you consistent information that has been relevant, that's been accurate, that's been consistent, and that's been clear. We go to the next slide, please. And as we talk about this in the various committees and task force that we have, we know that there's multiple methods of messaging. There's lots of ways that we can get the story out there. And we go to that next slide, we think about the sort of old school ways of communicating, what we used to call the grapevine. If you go to that next slide, Mary, that story that is often told across the fence or up the block or on your stoop generally is relevant culturally. That when you trust someone as a messenger around anything, it's important, and particularly when you think about COVID and testing and distancing and vaccines, the language of that message, the style of that message, how it gets brought to you, often it's how the message is delivered, the timing of that message. It can be printed materials, it can be social media platforms like Instagram and Twitter, but there's a range of ways that we can communicate with each other, and that underneath all of that story, this powerful vehicle about how human beings communicate information, communicate ideas, communicate dreams and aspirations, that stories help us create a frame of reference on which we can hang facts. So if you go to the next slide, we know that stories are often trumped by numbers, right? Numbers are often trumped by stories. We remember stories better than we remember numbers. So even though we have great data sets and we're starting to disaggregate that data by race and geography, generally what people remember is that sort of headline. The numbers going down, our hospitalizations remaining steady. Are we testing a critical mass, a critical number of folks to help us get out ahead of the pandemic? So this idea that we have these trusted messengers in Oakland, that we have people who have been part of the mayor's task force from community-based organizations. We've had the city, county, community outreach work group that's now moving into Oakland Thrives, which is an existing structure for us to have engagement with political leaders, with system leaders, with community-based leaders and other informal leaders, is part of that universe of trusted messengers. We have a lot of CBOs, a lot of community-based organizations in Oakland who are on the ground, who know their communities, who know their neighbors, who speak literally the language that they speak, who speak the style of communication that they speak. And those are the folks that we want to activate. We go to the next slide, please. So it's a really fundamental question for all of us when we think about messaging. Who do you trust? And if you're sitting there wondering, just think for yourself, like, is it a relative, grandparent, maybe, or uncle? Is it a elected official? When I was in public office in the early 2000s, and there would be a lot of polls that would be run around election time around who are the most trusted voices in town, and often Barbara Lee's name would rise to the top. And it wasn't, with all due respect, Libby, it wasn't the mayor, it wasn't school board members, it wasn't people on board of supervisors. It was typically classroom teachers, because a lot of our families trust our teachers and our principals. It was the minister of their local church or their imam in their mosque. And so from the public perspective, we have to work a lot harder to build the trust that we know is necessary for us to have messages that actually resonate with folks. If we can go to that next slide. The next question I would pose to the group is, why do you trust who you trust? Were they consistent over time? Were they consistently giving you good information? Were they even able to say, when you asked a pointed question, I don't know? One of the best experiences I had on the school board was when someone on the board asked a question to one of our staff. And the staff in December, actually I asked a question about something that was associated with our student enrollment and one of the programs we had. And after thinking about it from the dais in the public meeting, after thinking for just a moment or two, he said, Director Raj, I don't know. And to me, that was the best answer to give when that's the truthful one, right? And so it meant that over time, I began to trust that person more and more and more, because even when he didn't have the information, he was someone who could give me a solid, I don't know. And he said, but I'm going to find out the answer for you. I want to share just a quick story about who I trust in this community. One of the people that I trust is Dr. Noho Abla. She's the founder of Roots Community Clinic. She's been engaged in the African American response to conversation along with Nick Moss and others. And several weeks ago, we were having a public discussion about the flu vaccine. Now, not the COVID vaccine, but the flu vaccine that's being offered every year. And someone asked her, are you going to have the flu vaccine this year? And she was very thoughtful about it. And she said, well, for years, I have not necessarily taken the flu vaccine. I try to be careful about, who I come in contact with. But she said, but this year is a little different. I'm moving around in our encampment community. I'm moving around with my own children to be able to serve folks. And she said, this year, I'm going to take the flu vaccine because science is telling us that it won't prevent COVID, but if you were to be COVID positive, it may very well diminish your symptoms, right? And I had to think about that because I'm somebody who has not taken a flu vaccine, but the one time I took it, and I know I fell into the myth of I took the flu vaccine and then got sick 2 weeks later. And I blamed it on the vaccine, right? And so for me, I think that this idea of who do you trust and why do you trust them is important. We go to the next slide. I got a couple more things I want to share, and then I'll turn this over to our next speaker. Ella Baker, one of the leaders in the civil rights movement, who many of us now know about, was very clear about one thing. She said, give people light and they will find their way. To me, light is the information that a trusted messenger can present to help us make informed choices. Our public systems and systems leaders are always obligated to give us consistent, clear information. We go to the next slide. The other thing I want to share is that if you're old enough, you remember getting a polio vaccine. If you're old enough, right? And I kind of relate to this. I turned 60 last year when I was a kid in Pine Hill, Arkansas. Every year, so you had to go get a shot and all this. And there was this image of this little girl reminded me very much of the experience I had. And it was the sort of thing you always had this sort of scar, this little thing on your arm that let people know you had the vaccine. Well, there were a lot of us that took it because we also were afraid of getting polio because we saw some of our classmates get polio. And we saw them have to wear those braces and those big brown boots to kind of help them with their with their limbs. And so this idea that there are people around us who will join us in this. I heard that same kind of story from Nestor Castillo, who is a co-convener of the COVID, the advisory group with Kimmy Watkins-Tart and others. And so there's some lessons maybe from that period of time. At this one last slide, you can go to the next slide. How do we support then Oakland's trusted messengers? If we identify all those folks, how do we support them? Go to the next slide, Mary, please. It's the last one. And it has to do with, I think of our trusted messengers as storytellers. These are the people that can share the story of what we need to do. Neighborhood-based organizations, informal influencers in our neighborhoods, and what they need is to be resourced at scale. We need to make sure they get general operating support for their organizations. We need to make sure that they get project-specific funding to do this work. I want to invite you, and we'll put this slide up at the end. There's a meeting happening next week. We want to invite the public to continue to engage with us, to continue to give us ideas about how trusted messengers get activated, get resourced, and that we can, and then as the vaccine becomes more and more available, people know when it's their turn, know where they can go for access, know how they can participate in the important work that we're doing. I'm going to stop there. Thank you again for the opportunity to share a little information, share some ideas with you, and I will pass it back to the mayor to introduce our next speaker.
Great, thank you so much. And our next speaker I hope you answer the question that I think is on a lot of people's minds. And Greg, trusted messengers are so important. You made such a beautiful case, but I don't need I already heard from the trusted messenger. I trust you. I need to get a vaccine. I'm a 55-year-old white woman with no underlying health conditions. When can I get vaccinated and how do I do it? And my mom, I'm worried about her. She lives in the building that's right behind Greg's head. I've been thinking about her while you've been talking, because that's like literally her apartment building, right like next to your ear, Greg.
Over here.
Yeah. Now my mom, she's in her 80s and she has a lung condition. I'm really worried about her. When can she get vaccinated? How can I get her there? Please, that's what people want to know right now. Just no pressure, go ahead.
Sure. Thank you, Mayor. Thanks for having me. If you can bring up the slides, we can go ahead and jump right into it. So just first of all, my name is Nisha Balaram. I'm the Public Information Manager for the County Public Health Department, one of the public information officers working on the COVID-19 response. So you can actually move on to the next slide. So I think, to set the stage, I think it is important to help everybody understand why we're even talking about vaccine, how it'll have an impact on the pandemic. Dr. Moss, did you want to kind of give us your medical opinion on this?
Yeah, sure. Thank you. So I think first of all, it's amazing that we're at this place where we are so quickly. We're going to spend some time talking about why things are going slower than we would all want. But the fact of the matter is that we have these vaccines that are very effective and very safe, and we have them far faster than we could have hoped. But at the same time, all of the right boxes were checked. A lot of the work that we were able to take, the people who developed these vaccines were able to take advantage of, had already been done because we had experience with similar viruses in the past. And we were able to quickly get clinical trials, large clinical trials with lots and lots of people that showed us that these vaccines were safe and effective, and get them done this year. And it's got us in this position where we do have something that can really change the game. So what we know about the two vaccines that have been approved so far is that they can reduce the number of people who have COVID-19 illness, right? So what they do is they prevent you from getting sick. They can reduce the severity of disease. So if you're vaccinated and you're exposed to the virus, you're much less likely to go to the hospital because of that virus. So that means less hospitalizations and less deaths. Things that we deeply want. We don't know yet, but we believe that the vaccines will help get us to herd immunity. That's where when enough people in a community have been vaccinated, people who can't get vaccinated because of health issues, that they will also be protected, and that there won't be pockets of people who haven't been vaccinated, who aren't immune for some reason, where the virus can circulate and get out and affect people. So we don't know that for sure yet, but there's some early data that maybe that will be the case. We expect it'll be the case. We're going to learn more in the coming months. And bottom line is, if we're keeping people from being hospitalized and dying from COVID, hopefully keeping people from having any illness at all from COVID, that means that it's an earlier return to normal life. We still have to get vaccine into people's arms, though. I mentioned this before. I just wanted to reiterate, because it's only at the beginning, because we're still learning about the vaccine. Once you get vaccinated, we're still asking people to stay masked, to keep physical distance, all those other measures until we learn more and until we get more people vaccinated. We know it prevents disease. We don't know enough about how it affects transmission in the community yet to give up on all these other things that we've done such a good job of incorporating into our lives.
You can move on to the next slide. So I'll go ahead and talk about the slide. So basically, the way that vaccine distribution is working in Alameda County. So part of it is vaccine goes from the state and then is allocated either directly to some of the hospitals in the county. So if, Kaiser, for example, would get vaccine directly from the state. For the vaccine that Alameda County gets directly, the way that it's working in terms of getting shots in arms is we have what are called pods. These are points of dispensing. There are opportunities for people to make an appointment and come get vaccinated. So right now we have 3 locations where that's happening, and we're still in phase 1A. So that's healthcare workers and 911 first responders. And so those locations are in Castro Valley, at Lake Merritt, at St. Rose Hospital. And then what we're doing is also creating what are called, we're calling them megapods here. You might also hear superpods in the future. These are kind of what you've been seeing in parts of Southern California, these larger vaccination points where you can have a few thousand people come through in a single day to get vaccinated. And we're working on standing those up by mid-February. We're looking at a couple different locations right now. And so the other ways that vaccine is being disseminated in Alameda County is we're focused on long-term care facilities. So these are kind of traditionally known as nursing homes. There's a federal partnership with some of these facilities through CVS and Walgreens, but we're also helping support getting some of those facilities vaccinated sooner. And then we're also working with community health center clinics. So some of those that you would see in the Fruitvale and other parts of Alameda County, those are some places where people are also able to get vaccine. And in the future, you would see opportunities to get vaccinated in pharmacies, private care practices. And so a lot of these are the different ways, as more vaccine supply comes in, that we would be able to ensure more residents of Alameda County and workers are able to get vaccinated. So the kind of last piece of that is when we have more vaccine and we're able to expand outside of phase 1A, we'd be really looking to launch more community-based pods. So not just looking at the 3 locations that I mentioned up top, but really focusing in on areas that are highly impacted in our priority neighborhoods. So next slide. So what goes into the planning for vaccine administration is supply. A lot of times what I talk about is it's a supply and demand issue. There's a lot of demand for vaccine, and there really isn't as much vaccine to disseminate as we would like. And it's pretty inconsistent week to week. But then we also have to really focus in on who's in the prioritization category. So again, phase 1A are healthcare workers. And then there's a lot of folks in phase 1A. There's, somewhere around 145,000 healthcare workers in Alameda County that fall into that category. And then it's, how do you reach those people? So right now it's a direct invitation. We work through employers, we work through direct contacts and organizations. And so figuring out the best way to reach people is one of the parts of the logistics and planning. And then just making sure that we have enough people to really increase the number of pods that we have to really start up those larger pods that we talked about. Next slide, please. So this is the current prioritization framework. So as the mayor mentioned, the biggest question on everybody's mind is, when is my time? And this is really the layout of that. So where we are now, again, is phase 1A. You can see there's different categories of people in that. It includes 911 first responders, so the folks who are taking patients to the hospital, helping them get stable before they get to the hospital, but also our hospital workers, our nurses, the folks who work in homes, taking care of people who need that support in their homes. It also includes dentists, pharmacy workers, lab workers. So it's a really, really large category, and it's really large specifically for Alameda County. So when you look at the next phases, 1B is the next one up. And that one includes people who are 65 and older. It also includes our emergency responders and emergency services. So that's, our police officers. And it includes a lot of essential worker categories. And so you can see kind of as we move through the phases, the categories get fewer, but it actually, starts incorporating more and more people. But between a phase 1A and 1B, we're really looking at almost half the Alameda County population. So we can move on to the next slide. So after I've said all that, the state is looking at a new framework proposal. They've just rolled this out in their version of a community advisory group just yesterday. So what could happen is what I just explained might go out the window a little bit. What that would mean is really focusing in on age-based prioritization rather than that essential worker categories. So in the prior slide, 65 and up was a part of Tier 1 and Phase 1B. And really that would become the primary way that the state would prioritize vaccine. And then, there's some additional considerations that would come into play to really target those disproportionately impacted communities, looking at the Healthy Places Index, which overlaps high poverty areas in Alameda County. But the focus of vaccine dissemination and prioritization would be that age-based prioritization. So starting off with that 65 and up after we get through the healthcare workers in phase 1A. Dr. Moss, I don't know if you wanted to add anything about this proposal.
Well, maybe on the next slide I can jump in.
Okay, great. So the next big question is, how do I get my vaccine? So there's, I mentioned kind of right at the top, there's going to be a few different ways how people are going to be able to get vaccinated. Right now, pods are one way. Healthcare providers are another, though everybody is limited by supply. And so on our website, there's a way to get notified by signing up for notifications, depending on which form you fill out, whatever's applicable to you if you're a resident, an employer, or a healthcare provider. But Kaiser and Sutter also are providing public-facing portals so people can learn more about how they can get vaccinated. And then as more vaccine comes online, there'll be more opportunities for ways to get vaccinated in alignment with the state's prioritization framework. So I'll stop there. And then Dr. Moss, I don't know if you wanted to jump in.
Yeah, I mean, I think so. We know that this is really the question for a lot of people, and I think the good news is that we are really excited that there is so much interest, that people are ready. They're ready to get vaccinated, to start getting on with their lives, and but I think that the place we're in today is that the supply of vaccine in Alameda County, in California, and nationwide is not up to the demand yet, and it's going to go slow. And I want everybody to understand that we're gonna keep the ball rolling, but this is going to move. It's going to be a slow process, and this is not an Alameda County thing. It's not a City of Oakland thing. This is where we are with vaccine today, and so we want people to be patient, and we are going to work on all of these different processes that we've just laid out for people to access vaccine, to learn about when it's going to be available. But we also want people to be prepared for it to take some time as the supply improves. And I think that it's important to realize also that at the state level, where the prioritizations are being done, that everybody is working with the best intentions to try to get vaccine in people's arms as fast as possible, and trying to be mindful of the equity issues, but also trying to adjust and flex as we learn more about how quickly vaccine is going to come, and making sure that we are protecting the people who are most at risk of severe illness. And so that's why we're in the place we're in today. It's an absolute imperative that we protect our healthcare workforce so they can protect us, so that we can keep our systems running, not just for people who have COVID, but who have other health conditions. So they're not, the staffing challenges that healthcare systems have had, particularly in these recent weeks, are profound. And we really need to protect that workforce so they can protect all of us. In Alameda County, that's a huge number of people, 145,000 people. And a lot of people are doing a great job of getting those people vaccinated, but we do need to get those, do as good a job as we can getting through that group, and then move on from there. And so I'm hearing people. I know people. They want to know. They want more questions. It's been a confusing process. They want to know when it's going to be their turn, and we are working hard to be able to answer those questions. But it is going to be slow at least for the coming weeks.
Dr. Moss, thank you. And, I think people just appreciate an honest answer that we don't know. And I've, asked you privately, and you've done a great job of explaining that one of the reasons Alameda County feels behind some other parts of the state is because the unusually large amount of healthcare workers we have in this county. So it is somewhat of a blessing that we are still in this early phase, because we have so many healthcare workers. I know my dental hygienist sister already got her vaccine, her first one. So I know it is getting to that third tier in your 1A category. But I'm going to pose a couple questions that I think are good ones, and you might be able to clear up some things. One question that we got that was highly rated was, please hurry. It's incomprehensible that delivered vaccines are still sitting on shelves. So one, are delivered vaccines sitting on shelves? And then the second part of the question I think is great. Can we volunteer to speed up? Do you need volunteers? Inoculation is more important than prioritization, tiers and phases. Please feel the urgency. Just vaccinate en masse. And I think I heard you say that you are still also under the direction of the state government, and they are making some of these bigger calls. But is that true? Are vaccines sitting on shelves?
Vaccine is not sitting on shelves, but we need to, we need to get people scheduled, get people at the vaccine clinic, and get those staffed. Make sure that things are going safely. We're doing several thousand people a day. I think it's 2,000 first shots and 1,000 second shots are being done a day at county sites. That's not including shots that are given by where like the Sutters and Kaisers of the world get vaccine directly from the state, or the nursing homes are getting vaccinated through a federal program. So we are moving through that supply as fast as we can, and we have we have to hold some back for people to get their second shot, but we're actually using some of that as well just to keep the ball rolling. Now that the state has granted us permission to do that, so I think it's very much the opposite problem, is that we wish we had more vaccine on our shelves.
Well, thank you. And that kind of answers, I think, two other questions that we've seen. And if you're done with the slides, we can also put back up the thought exchange to remind people who have not submitted their question yet. You are invited to submit questions in real time, although we've certainly gotten a bunch ahead of time. But two questions, really. How can you assure the public that no vaccine will be wasted? There are reports coming from other parts of the country that these vaccines are sitting on shelves. They have an expiration date. It sounds like Alameda County is doing fairly well. You've assured us that nothing is getting wasted. Is there anything else that the public needs to know about how you're ensuring that nothing goes to waste?
Yeah, I mean, this is one of the core principle. I mean, this is everything should be done to avoid that outcome. And so there's a few things. We're making sure that we have the capacity to store the vaccine that we get. We're making sure that providers who get the vaccine can store it safely. Now, when you open that vial, you do need to use it. So that's why we're for the most part relying on appointments, so we know how many people are coming in. It's not just this is why you have to have some structure built into your system so that you can plan ahead, make sure that you have the right amount of vaccine with you, and that when you open that vial, people are coming to their appointments, and so that you don't have to waste it. And then the other thing that we're doing is we are going to make sure that we use all the vaccine that we have. And we have developed systems with our pods so that we can pull people in quickly who are eligible to receive vaccine but might not have had an appointment that day, to make sure that we can give them vaccine. Because the last thing we want to do is, even if it's just you have one vial that you opened at the end of the day, we want to make sure you use that up. So we're doing everything that we can to make sure that that's the case. And we would rather get people vaccinated than have it go to waste because we couldn't get somebody, the right person through the door.
Great. All right. It looks like we have some new questions, although I'm going to ask you one other that we got submitted ahead of time because I think it's an interesting one. If you are not a healthcare worker, are you prohibited from traveling to another county to get a vaccination where you do not reside? Some people have heard some counties have more vaccines than others. Is that allowed?
I can only speak for Alameda County, and because we're working with an appointment system and we're still vaccinating healthcare workers, and it's employment based. So we would, if you work for Kaiser and you live in a different county, but you work for Kaiser here, they are allowed to vaccinate you because you're their staff. But I don't think that we have had that situation come up for us, and I can't speak to how other counties are handling that.
Great. I'm going to combine these questions. One question is, how did Kaiser get to do vaccinations for 1B? Now, that presumes that that's true. And then also, when will Oakland police and Alameda County deputies be able to get the vaccine? They are obviously high on your priority list. They are busier than ever right now. These are our first responders. I can tell you from experience, we've had infections that have really impacted our ability to deliver public service and public safety. So I don't know if you have specifics to those two questions.
So the state has made clear that older adults, people over the age of 65, are a top priority. Now, there's some structure in that. We still need to prioritize 75 and older. And they have also made clear that the Kaisers and Sutters of the world, that healthcare providers, once they have got through their staff, if they have vaccine supply, that in many cases they've received directly from the state, that they can go on and start to schedule their members. And so that's why you are hearing of some older adults being able to get an appointment at Kaiser and get vaccinated. And to be honest, I think that's okay. We really want to protect that population. And I think the state is doing its best to make sure that if vaccine supply is going to be slower than we had originally hoped, that there is a window there. I do want to be mindful of the potential equity issues where if older adults are only able to access it through a Sutter and a Kaiser, that's not ideal either. So we really do want to be able to make sure that we address that in our vaccine planning going forward. In terms of the law enforcement and first responders that are not medical first responders. Medical first responders are healthcare providers. As you heard in Alameda County, we just have a huge number of healthcare workers, a large healthcare system. I think more hospital beds than any other Bay Area county. Don't quote me on that, but if not, we're close to it. We have a large number of skilled nursing facilities and other similar healthcare facilities with lots of staff. It's about 145,000 people, and that is, no matter what this gets changed with the priorities and things like that from the state, that group is still going to be a top priority. And so we're not to those later tiers yet. Other counties are smaller. They're able to move through that group faster. And so you may be hearing from other counties that some of those law enforcement personnel were able to get vaccine. They're in the 1B tier, tier 1. So, but here in Alameda County, we're sticking with our priorities from the state.
And Dr. Moss, it's okay to say we don't know. Like, I think government officials need to say that when it's true. Well, so I think that's what I've.
But I just want to make clear, we do know why that group hasn't come up. So I'm sorry if it sounded like an evasive answer there. We just haven't got to that tier yet. But I agree. I mean, I think there's a lot of things we don't know, particularly around the supply and when it'll increase. Supply is coming in. It's just coming in slower than we would have liked.
Okay. Well, we know that you're not doing them now, but people are asking, when will police officers get vaccinated? There's another question. When will teachers be able to get vaccinated?
For now, we're saying February. We believe February, when the vaccine supply is here, we're through the healthcare workers. February is our operating February.
Great. February is 2 weeks away, so that sounds very encouraging. As someone asks, San Francisco has announced they want to vaccinate all eligible residents by June 30th. Is Oakland able to commit to that same goal?
I think it's admirable that San Francisco is committed to that goal. If I knew that we were going to have the vaccine to reach our, some 1 million plus residents with 2 shots of vaccine by that time frame, then I would say yes. I don't know that we're going to have that vaccine.
Okay. There's a question, are we abandoning the county's banded together approach for vaccination? Certainly you worked very collaboratively with the other Bay Area counties through testing and through different health orders. It says it seems Alameda County is worrying about Alameda County not very efficient. What do you have to say to that question?
Yeah, well, this is how the vaccine has been allocated by the state. It's been allocated county by county. So the ways that we're working together, first of all, we do try to coordinate and make sure that the intention was to try to coordinate and make sure that we were generally vaccinating with the same priorities. But because of differences, as I mentioned, in population sizes within the counties, we can't all go at the same time with the same groups, and because the allocations are county by county and not region by region, each county is treated independently. Otherwise, I think we just want to be as an alignment as possible about our communications about vaccines. So that's the other place where we really try to be on the same page with each other. I think it's, certainly we do communicate, but ultimately each county is responsible for being in charge of vaccine coordination for their own jurisdiction.
There's another question that was asked in the pre-questions that I think is actually very good to get clarified. We did in our presentation encourage everyone to go to covid-19.acgov.org and click on vaccinations and register for a notification from Alameda County about when you can get your vaccine. Someone, aside from asking about where can they get notified, they said there are several resources circulating, including calvax.org, which had misinformation. Are you encouraging people to use Alameda County's notification system instead of a state one or other ones that are circulating?
Yeah, there's a lot of confusing materials being circulated. I think many people just, with good intentions, trying to get the word out, but it has caused some confusion. So yes, please use our website that the mayor just shared and that I think is, you can see on our slides, register, and you can get notified about when you're eligible to receive vaccine.
All right, and fabulous interns, you can put it in the chat or in the social media feed one more time. That link to sign up to get notified directly. Here's another good question. Will there be a vaccine mandate?
So there's no mandate. We're not planning a mandate in Alameda County for any particular group. I don't think anybody is across the state. I haven't heard of one in other parts of the U.S. And the reason for that is, although these vaccines are safe and effective, they are just approved as an emergency use by the FDA, just because of the way the FDA's process works. And so for that reason, everybody has opted for a strong recommendation.
There was also a question specific to boarding care facilities, that there are a lot of that type of facility, especially in the Fruitvale that we know has been hard hit. And then a very specific related question, I am a healthcare worker. Why haven't I gotten my first vaccination yet? I want to protect the elderly people I work with.
So I first of all, for the healthcare worker, I strongly recommend you go to our website. There's a separate link for healthcare workers to sign up to be notified about opportunities to get vaccinated. We know a lot of healthcare workers are able to get vaccinated through their employer. But some, for various reasons, that doesn't work, and so that's the way to get information about getting vaccinated. And then in terms of so for licensed care facilities, there are the Federal Pharmacy Partnership, CVS and Walgreens, are under contract with the federal government to deliver vaccine. And we are in the county assisting, plugging the gaps, making sure staff that aren't able to get vaccinated through that program get vaccinated. And for some facilities that didn't sign up for that federal program, that they're able to get vaccinated. And so that's the way the process looks in Alameda County for those facilities.
Great. There are a couple questions asking us why are things different here than in LA, although I was just speaking with Mayor Eric Garcetti today, and I would not change places with him for anything. LA just looks really, really devastated. But there is a feeling that there are more of these megapods already up and running in LA. Why is Oakland and Alameda County not as far along in that type of distribution system?
Nitu, I don't know if you want to jump in on this. I think our megapods are in planning. We've had small pods running for some time, and I'm not familiar with what's on the ground here there in LA. But Nitu, do you want to?
Sure. So we are working on standing up super pods or megapods, whatever you want to call them, and they will be coming online. Again, a lot of it has to do with ensuring we have enough folks able to staff those megapods, because there would be, thousands of people coming through versus, about 1,000 that comes through the normal size pods that we have right now. And then again, it's ensuring that we have enough vaccine supply so that when we do launch these super pods, that we're going to have enough to actually bring people in and get them vaccinated. But they are in process. We're expecting to be able to launch those in mid-February. It's a great partnership actually across both the Public Health Department and the Healthcare Services Agency, but also our partners at the County Fire Department and a number of other folks who are really working hard to get those up.
And as Dr. Moss knows, I've joined Mayor Garcetti and a number of other mayors across the country suggesting to accelerate vaccine distribution, that they may distribute some directly to large cities where we have firefighters and others that are trained in giving injections as well. So we'll see what the Biden administration has to say about our proposal, because I know everyone is anxious to get this out. Just to dig in a little bit more, and Nitu, this might be a question for you as well. I presume Los Angeles probably has more healthcare workers than we have, but that the actual distribution of vaccines is probably proportional to population. So I'm presuming Los Angeles got a lot more vaccines than we did, and so has been able to kind of have to stand up mega sites from the beginning. Do you want to? Is there any other detail you want to provide about why Alameda County feels less ahead than other places, but it potentially has to do with the method of distribution of this just precious resource?
Sure. I think one of the things that is important to remember that people actually probably don't know is that Alameda County doesn't have a healthcare system. We, have safety net hospital systems like Alameda Health Systems, St. Rose, Washington Hospital and Fremont. We have great partnerships with community clinics, but we actually don't run our own hospital system. So I think oftentimes that can be the confusing piece about some larger counties, LA being one of them. Santa Clara County, for example, has a healthcare system. So a lot of the direct vaccinations that we could be doing, we have to do through these pods.
There's a question, will people be able to volunteer to assist with vaccine distribution? Is there a training someone could take so that they might assist and be of help?
Dr. Moss, I don't know if you wanted to take this one.
I think we don't have that set up yet. We're focused on, again, we have actually staff to staff for the vaccine that we have right now. But I think as we stand up larger sites, when there's more vaccines, so we can distribute thousands more doses per day, that could impact the staffing needs. We love the volunteer spirit here and how many people want to do the work, but we also want to have work and be able to coordinate those efforts. So I think more to come on that in the future.
And I would just quickly add, the state has a system for healthcare providers to sign up to become vaccination sites themselves. So CalVax is the state system. We really would encourage any healthcare provider that hasn't signed up to be a vaccination dispensing point to do that, because what that does is it allows the county to actually say that provider can get vaccine. They can vaccinate their own healthcare workers. They could start vaccinating patients. Those are some different methods for more opportunities to give people, so that when it comes time and there's again enough supply, we've moved through the right phase. People can actually access vaccine through a private primary care provider, for example.
And I have heard that a number of dentists are doing a small training that also will make them eligible to effectively volunteer to also give vaccinations. Is that correct?
Yes, dentists are enthusiastic. They are, I believe it's a few hours of training that they have to do at the CDC level. I think there's like an online program or something, but that's one of the steps that the dentists are taking to be a part of the system. Well, thank you.
That's very, very generous of them. Do you have an estimated date or time when you believe non-essential workers under 65, I will add, will be eligible to get the vaccine? And if so, approximately when might that be?
I'll take this one. We don't know.
I think that is a fair answer. Just dear people of Oakland, remember, no one has ever been through a global pandemic before. And so I think Alameda County has been doing an excellent job. And I know that we will continue to have these forums because more information will become available every day. We want to get it out to people. We want to be transparent. And when we don't know, I think it's very important that we just say that. I think it's fantastic. So thank you. Let me see. Here's a question. Someone has their mother, who is from Illinois, living with them to help with childcare. And she is on Medicare, but she's not, a certified Alameda County resident. How can non-residents sign up for a vaccine appointment? Now she's staying here, but she wouldn't have proof of residency.
Please jump in, but I need to, if I get this wrong, but I think she just could sign up as if she were a resident and on our website. And I don't think that there would be I don't think that would pose a problem.
Okay. And it's good that some of these questions are coming up, because this will put some of these issues into the minds of the people that are trying to figure out these systems. So thank you. The very specific question: when will the vaccine be in my over 70 arm? I have pre-existing conditions.
Yeah, I think for people who are over 70, the timeline is much shorter. I don't know. 75 plus is official, top age priority group, but hopefully moving on to 65 soon. It's still a little bit vaccine supply dependent, and it may depend on where you're getting your care. But I would hope that by the end of February, you'll be able to get a vaccine.
Okay. And that answer probably goes to someone who's also asking about their 89-year-old father. So hopefully by the end of February.
Yeah, and it could be sooner.
All right. And it sounds like you're also encouraging people, if they have insurance, to check with their primary medical provider first before looking to some of these mass sites and waiting for the county. Is that correct also?
That's right. Certainly the large providers already are able to, I believe, schedule appointments in most cases. And then hopefully more and more providers will be able to do that in the coming weeks. So absolutely check with your provider first.
And that information is available on the website too, on our website.
Great. Again, covid-19.acgov.org. I have it memorized. All right. There's a question about any specific facts on COVID cases. Black and brown communities and districts 5, 6, and 7 have been disproportionately affected. Very troubling. That is absolutely true. Like so many health issues, we see racial disparities, we see economic, geographic, as well as work class disparities. Dr. Moss or Neetu, do you want to add some specific learnings that we've had regarding racial and place-based disparities with this pandemic?
Yeah, thanks, Mayor. This is, this is the story of the COVID pandemic, not just here, but in many places in Oakland's communities of color, particularly, people who work in essential jobs, which is kind of a loose term, but it really means people who had to leave the house to go to work, often working closely with coworkers in the food and agricultural industries, healthcare industries. I have the privilege of working from my living room, but many people do not. And it's also people who were working those jobs and then living often in close quarters. Housing is not cheap here, so crowded together in smaller dwellings, maybe more than one family in the same dwelling. So those really accelerated transmission and created the disparities that we're seeing, and particularly in Oakland.
My memory is we were seeing double the death rate in our African American community, and at one point 20 times the infection rate in our Latinx community. I believe it got down to more like 4 times, but huge disparity in infections in Latinx communities. I will credit Alameda County for really being intentional around addressing those disparities. I was proud to see one national study that showed Oakland and San Francisco to be the only cities that they looked at that actually had better access to free testing, free medical information in low-income communities of color that were most impacted as opposed to other communities. Greg Hodge, I don't know if you're still on, but this is also a subject that I know is near and dear to your heart. Is there anything that you also want to add about what we've learned around health disparities in this time of COVID?
That was for me. Can you repeat the question? I got a little distracted.
Oh, I know. I'm sorry. We've been all in like vaccination distribution, but there's a question.
I totally get it.
There's a question specifically about what have we learned about the health disparities in COVID, particularly in Black and brown communities, East Oakland being disproportionately affected. I just thought this is an issue that I know is very important to you. And did you want to chime in on it?
Sure. Yeah. And I will say that in the early days of the pandemic, we had very little data that was disaggregated by race. So we didn't really know. And I think Nick and Kimmy Watkins-Tart and Colleen Charlton, our health folks, have been really responsive and were able to really show us, every time the African American Response Circle met, we had a chance to see what does this look like for Black folks, what does it look like for Latinos. We knew that there were particular zip codes in West Oakland and East Oakland that were hardest hit for many of the reasons you described. Essential workers, people who were working in food distribution, people working in warehouses, people doing, that kind of work. And so we've been paying a lot of attention to it because we still, I think, unless Nick tells me something different, we're seeing a pretty high number of by percentage, African American deaths. So a lot more deaths in the Black community. And again, it uncovered those pre-existing comorbidities, those pre-existing health problems, diabetes and hypertension, and other things that made African Americans and Latinos more vulnerable. And so we've tried to be very focused around this with people like Dr. Kim Rhodes and her work. She's partnered with us from University of California, San Francisco, on a Moja Health project to do when we were really focused on testing, pop-up testing in these key, vulnerable neighborhoods. And so I'm thinking that we'll do the same thing, that when we get more supply of vaccines, we can have the ability to do that in different locations now. And my caveat is I'm not a health professional, but my understanding is that it's harder to do vaccinations in a parking lot than it is to do testing in a parking lot. And so there's got to be some attention paid to those points of distribution that can be safe, that can be targeted by both geography and race. And so I think we've done a decent job of getting that data. When you talk to Damon Francis, Noha, and others who are working in those specific communities, I think they would agree that we still have a long way to go, and it really does raise the issue down the line. How do we make sure that nothing like this happens again in terms of these disparities? So that's a little bit. So thanks for the question. I was actually enjoying Nick and Nick to respond to all of these vaccination questions, because I get it. I mean, that's the thing that people want to know. But I will say one last thing. This notion of trusted messengers is important, because let's assume we had as much vaccine as we needed, that we had 140,000 units or 280,000 units if you got to do the first test and first vaccine and second. There's still a lot of distrust in the Black community around vaccines in general. And so that's where we've got to do some really targeted work in our community, and as well in the Latinx community, to say that when this is available, here's the benefit of it. And the point I was trying to make earlier is that the more we educate people along the way, the better chance we're going to have of getting people to do what I did when I heard Noha say, "Hey, I got the flu vaccine. It influenced me to get a vaccine." I think that having everyday people do it, I think having our celebrities and athletes is great. But people already know. When you look at, I saw Kareem Abdul-Jabbar, one of our legendary basketball players. He's showing himself getting a vaccination. Well, he's over 75, and he's a pretty wealthy person. So I'm sure he had access to this in a way that I didn't. Now, if I see somebody in my neighborhood who has gotten the vaccine, somebody that I trust on my block, maybe I'm more likely to do it if I'm the guy on the block.
Great point, Greg. And I can't think of any better trusted messengers than you. I do want to be mindful. We are almost out of time. There are a couple more questions I'd love to sneak in here. Actually, to your point, Greg, one of the questions is, have you been vaccinated? Me personally, no, I have not. I am waiting my turn. I think there are a lot of people that need to be in front of me personally.
Yeah.
Now, there's some questions about the two that are very related. Once vaccinated, after the second shot plus 14 days, do we still carry the virus home to our family members who are not vaccinated? To make fully sure that even though I am protected, I do not want to continue to spread the virus. And as a related question is, if you have had COVID-19 diagnosed this year, will you get a vaccine? It's not clear from the information how a previous diagnosis impacts where you are on the vaccination priority list.
First, for the first question, for the time being, we are telling people that yes, you need to keep masking and doing all those things that you've done to protect your family members. Even if you've been vaccinated, we think, but we don't have the proof yet. We don't have the data yet to say that you're not going to pass it on. So until we have that in black and white, we're telling people, keep wearing the mask, keep doing all the things that you've done to protect others, even after you've been vaccinated. And then, I'm not sure if this was part of the question, but the vaccine itself, it's not one of these vaccines where there's a live virus in it. So nothing about the vaccine, if you get vaccinated, that does not pose any risk to your family members. Just wanted to make sure people understood that. And then the other part of the question, Mayor, just jog my memory.
just if you already had, if you've been diagnosed with COVID, does that change who you are or how you approach the vaccination process?
So we are recommending vaccine regardless of whether you've had it in the past or not. And people who were previously infected were included in the vaccine trials, and it worked in them. And we don't have a reason not to vaccinate that population. We are vaccinating that population as well.
Great. Well, listen, it is technically the end of our time. I'm going to ask each of you to give us some closing thoughts. Greg, I think you should go last because you're going to wrap it up in an aspirational way. I will just say again, for me, I feel like I got a vaccine. I got a shot in the arm this week when Donald Trump left the White House. We had a federal government that really said, local governments, you're on your own. We can't acknowledge that the development of the vaccine was very fast, and so we can celebrate that. But to have someone who is literally at war with our city and our community, to know that that person is not in a seat of power, and that we now have people that care, that have brought people like our own Bashara Shuker, who was on this town hall not so long ago, is now the head of vaccinations for the United States of America. So we have people that love Oakland, that know Oakland, now in places of power. They are here to actually help us, not hurt us. So I just want to acknowledge and give people, like, this 2021 is going to be the year of hope and healing. And I am just full of hope this week. Dr. Moss, I appreciate your honesty about what we know now, what we don't know now, but we will know in days, in weeks. And we will be back with you, Oakland, to keep you updated, to be honest and open and forthright, and to engage in this important dialogue in this unprecedented moment. But I am full of hope for healing in 2021. Dr. Moss.
Well, I appreciate everything you said, Mayor, and I'll just add, I know people had a lot of questions tonight. You probably didn't get them all answered. I am willing to come back again. I really appreciate being able to join this forum, and we will have more to share each and every time. And I know people want to get the vaccine as soon as possible, and it's not gone as smooth as anybody would like, but we are working day and night to get Alameda County vaccinated. So thank you for having us.
Thank you. And fabulous interns, if you could put a link into the Racial Disparities Task Force final report for people that asked about how we're going to make sure we don't see these disparities again. You'll see our action plan in that report if that can be found and linked. Neetu, please give us some closing words.
I thank you again for having us. I think the only thing I would really just say is continue to keep an eye on our website, keep an eye on our social media at Dare to Be Well. We continue to try to populate both spaces as much as possible with the information that we have, and keep it as current as possible. But those are going to be the two places where you can always find more information if Dr. Moss isn't able to, be here every week. Those are going to be the places where you can find the information that'll keep you apprised of what's happening.
Great. And then Baba Greg, take us home.
Well, I just want to say thank you to everybody who's been on this call, everybody who's contributed anything positive to this conversation. I know that we've been, as a community, we've been through a lot. This past calendar year was just rough. Some of us lost family members, but I know that, and I'm humbled by the fact that this community has come together in a way that I've never seen. I've met more people in the last 8 or 9 months who I didn't know, and I've been somebody who's been pretty active for the last 30 years, but I've met a lot of people in Oakland who have goodwill, who have skills, who believe in the science, who are doing hard work and who are doing heart work to make us healthier, to make us safer. And I just hope that as we go into the year that we take the best of who we are as Oaklanders, that we take the best of who we are as Californians and best of who we are as Americans, and continue to make things better, and not make things like they were. Like, let's create a new way of being with each other. Like, let's create a new space that we don't have to worry about inequities that have been plaguing us for decades and even centuries. So I'm hopeful that in 2021, that we'll show the world who we really, really are. And it's not what they call you, it's what you answer to.
Yeah, I think we have a new president who campaigned on the theme, Build Back Better.
Yeah.
With that, Oakland, be well, good night, and please keep in touch.